Hi, so this lecture now is about what is the role of a strength and conditioning coach and a physiotherapist. Now, this is something which is often maybe not taught in a lot of universities or is something that people just encounter when they get onto the field. Now, there are two of these professionals who work with the body, and I have in the first lecture explained how in the physical realm it's the strength and conditioning coach and the physiotherapist, both of whom are important for um, making sure that the athlete's body is in good shape. So now who does what? Okay, can a physiotherapist be telling what exercises to do in the gym because he or she feels that these are some of the weaker muscles, maybe some of the smaller muscle groups, or maybe there's a bit of stability that is required. So can a physiotherapist decide that? Or is it the strength and conditioning coach who decides this? And can the strength and conditioning coach get into teaching exercises which are more done for rehab post an injury? Let's say a player has had a shoulder strain, and over time, it's been decided by the surgeon or by the appropriate medical person that some strengthening is required for the rotator cuff. Then at what stage is it that the physiotherapist comes in? At what stage is it that the strength and conditioning coach comes in? Who does what? Okay, this is what we're going to get into today. So number one, if you're working with a player, how do you know what to do? Is by your contractual agreement. Your agreement is extremely important. Your contract is important. What are you hired as, or what are you signed as for that particular place? Are you contracted as a strength and conditioning coach, or are you contracted as a physiotherapist? So this clarity is important so that you know exactly what is the contribution you can make to that player or to that academy or to that center. Okay. A lot of times there's a lot of friction, okay, which happens due to this, sometimes due to misunderstanding, sometimes just not due to clarity. And the physio can think that he knows more, or the strength and conditioning coach can think that he knows more. So how do we sort this out in a real world scenario, okay, where people are working, let's say with a cricket team, a football team, or with a tennis team, or with a tennis player? You have to know exactly what you do and what you can do. So now here comes the tricky part. If there's a physiotherapist who's a traveling physiotherapist, who is there all the time with the team, and then there's a strength and conditioning coach who decides this is done in the gym, and both of them maybe decide that these are the weaknesses in the player and physical, and this has to be done. Okay, it's extremely important that both don't interfere in each other's businesses. This can be difficult, but it is important, because the moment we think that okay, if I'm an SNC specialist and there's a physiotherapist who has an opinion about, say, a player that I work with, and he or she thinks that maybe this is what is weak and this needs to be done, okay, and I would have my own opinion from my own assessments that this is what is required. Now, how to understand where what comes in is, I would say, a simple thing, which is pain. If there's pain that the person has, that your athlete has, then the physiotherapist comes in to make a basic assessment to know exactly what this is and to give an opinion about the pain. And if they say that during this pain period, till the pain goes off, let's use maybe these exercises. There are some muscles, probably your gluteus medius, or maybe some of the rotator cuff muscles, especially the external rotators, are not as strong, and the physio says that this can be incorporated, then that has to be taken into account, because at that moment, in that setting, the physiotherapist is there as one of the medical reps to work on an injury. If there is no injury, okay, there's zero injury and everything's going good, then the decision comes from the strength and conditioning coach to decide what is to be done in strengthening or in the gym. So this is extremely important to be understood. When there's pain, the physiotherapist comes in. When there's extreme pain due to maybe um, a fall, and a person has had a ACL ligament rupture, then it goes beyond the physiotherapist. Then it becomes the surgeon, the orthopedic surgeon who's going to operate. Then his opinion matters most. Then he will make a judgment. Based on that, the physiotherapist over time after the surgery will do rehab. Then after the rehab is done and the person is fit to play again, comes the strength and conditioning coach. So pain becomes the middle ground where both sides know where to sort of draw a line, okay, who speaks where. And if this line is clear, then I think it makes it very easy to work for both sides. But if on the contrary, the physiotherapist gives opinions when the player has no pain, and the S&C coach gives opinion when the player has pain, they are crossing their boundaries. So you have to be extremely clear in the beginning what is whose role. Sometimes when you work in a team, there could be a physiotherapist, there could be a nutritionist, a psychologist, so many players. In bigger teams, you have these different roles. Now, what if a team wins and we sometimes think, hey, but I get along very well with the physio, I get along very well with the nutritionist, we're all good, we're happy, we know each other for long, okay, and we don't have this problem of, definition, we're all good, they tell me some, I tell them some thoughts and we're all okay. Now, this is okay till the point where you think this physio or this nutritionist is your friend or they think you're their friend, okay. What happens when a new physio comes in? Or when a new strength and conditioning coach comes in, or when a new nutritionist comes in? Now, when they're not your friend, how do you deal with it? So whether it's your friend or whether it's somebody you don't know, the standard of work should be same. And of course, when you're working, you're not working with friends, you're working with professionals. So this part is important, that the contractual agreement and the roles are defined in the beginning and we don't interfere in each other's jobs, and then ultimately we are able to create a surrounding which is conducive to improvement for everybody, including the player. Otherwise, if there's friction and each person gets into the other person's realm and keeps talking about what they think, we are just making life difficult for everyone. So in my personal experience, when I work with athletes, it's extremely clear from the beginning, what is my role, what is the physiotherapist's role, what is the nutritionist role. I will not give advice on nutrition. I'm not a nutritionist. The physiotherapist doesn't give me advice on strength and conditioning unless there's pain, and if there's pain beyond the physiotherapist's knowledge or beyond his or her capacity, then we get to the orthopedic surgeon. So we're very clear who does what. The physiotherapist doesn't do the surgery if that's required, okay, and the surgeon doesn't do the strength and conditioning, and the strength and conditioning is not done by the nutritionist's job is not done by the rest. So this part is extremely important if you want to have a good relationship and a good working environment. And this is where I have seen a lot of young and sometimes even experienced professionals make mistakes where they just assume that we're all friendly, we're nice, we're part of a team, and we're all together. And what happens when the team breaks or somebody leaves? Then you have problems. So it's important to have this clarity exactly in the beginning. Pain is that definition. If there's pain, then we need to get the help of a physio who will probably also recommend certain other things for recovery, and if there's no pain, comes the strength and conditioning coach and the technical coach. And the physiotherapist can still play a role where there's, recovery. So recovery protocols, some physiotherapists are extremely good at, managing that part of ice baths, a lot of passive stretching, sports massage, a lot of them play a very good role. In an ideal world, okay, in an ideal world, and this is an important point you should remember, the less time you have to spend in dealing with rehab, the better the job that you're doing. Obviously, this makes sense, right? If there's a player who has been training majority of the time and is strong enough and his load is managed well between the load which is done technically, say playing cricket or playing football, and then the strength and conditioning, and they are spending least time with any niggles, then you've done an amazing job. If they go to a physio and they say, I only need a sports massage and I'm good, you've done an amazing, everybody's doing an easy job, everybody's life becomes easy, okay. But the more they have pains due to overloading, and then they have to go to the physio, then to the surgeon, and if there's a surgery, obviously, then things take a lot of time. So in an ideal world, you want the least time spent on this side of pain, where pain is more. You want to be on this side, where pain is less and where there's more performance. So there will be a separate slide and a separate lecture which I'll be doing about that, between the difference between performance and pain. Okay, but understanding these roles and clarity in the beginning is important. Second point, of course, comes about you could be a physiotherapist or you could be a S&C coach who thinks he knows about injuries, or somebody who thinks he knows about strength and conditioning because they've done a 2-month, maybe qualification. So qualifications also determine what you're good at and what you do. And physiotherapy is, of course, a 4-year course, sometimes a 5-year. So there's a bit more clarity. A doctor is, again, there's much more clarity. Nutrition, if it's a degree course, there's more clarity. Strength and conditioning, unfortunately, yet has not gone to the point where there's clarity as in who is a strength and conditioning coach. Like, who can call themselves a strength and conditioning coach? Point is, almost anybody. If you are training, you can say, yes, I'm a strength and conditioning coach. What do you require? There's so many courses out there. Some are just like 1 week, some are 2 weeks, some are just 3 weeks. Sometimes you have a coach who might just turn up, create a workshop 2 days, 3 days, and you're a level 1 S&C coach. Now, are you really an S&C coach? Do you really have the experience? Have you really put in time? And what are the qualifications? Do you have at least a minimum of a sports science degree, if not a master's? So qualifications become something which is a bit tricky and a bit unclear on the strength and conditioning side, and hopefully in the future there should be some guidelines on this. But qualifications become important, and in an ideal world one should have spent, to be a good strength and conditioning coach, at least a 3-year learning program. Post that, you should have put in a good amount of time getting an internship done, across different sports, not just one sport. If you only worked with one sport, you are only good at doing that. Okay, so you should be working in different sports, and then that is what determines what you can do. So qualifications, and then comes experience. Okay, so qualifications, ideally a 3-year studying. Now, I know in India there's not many courses out there which are so specific, because not many people get into strength and conditioning. But then you should at least have done some qualifications and then work after that. Okay, but just assuming that you can be a strength and conditioning coach because you're just lifting some weights, or just because you're a physiotherapist who thinks that, okay, I've done this course, this is where conflict can start. So you have to be very clear what you can offer. Okay, and now once you have, let's say, these two, you have the contractual agreement, and once you have your qualifications, how do you know that this is more from a self-reflective point, just to reflect on yourself and ask yourself, are you really a good strength and conditioning coach? Okay, maybe even a physiotherapist has to ask, am I really a good sports physiotherapist? How do you know? It's your experience. Okay, over years, you have to look at the amount of people you worked with, and most importantly, what was your contribution to that particular sports person at that particular time. There is a separate section which I'll be doing on dealing with famous athletes or celebrities, and we'll talk about this. Just because you worked with somebody who's very famous doesn't mean you've done a good job. You have to be able to reflect yourself and check, what did you do? That famous person who came, did they have maybe a weakness in a particular part or in a particular movement, and did you help them, and did they improve? And that was done, you've done an amazing job. But if you've just been around a famous person and you think like, okay, I've got a picture with this person and I was with them, so what? Pictures can be taken by fans as well. So again, some harsh points, not the best to hear, not everybody likes to hear this, but this is a fact. Okay, if you want to ask yourself how you're improving, and we should all improve, otherwise how do we know, that we're moving on further in life? You have to ask yourself, what have I done? What did I contribute? Okay, whether a player wins or loses. So if I give an example, if there's, say, a player who has won a title, okay, and won some great match, you have to ask, in the last probably 6 months, 1 year that you've been working with that player, what was your role in that player's winning? Was the player fitter than what they were? Were the movements better? Or did you just happen to be there when they won? And this can happen, okay? Sometimes, again, some sensitive topics I'm talking about, sometimes a physiotherapist can be traveling with a team, sometimes a strength and conditioning coach can be traveling with a team, and the player, it just happens to be a nice performance, and you would have probably never even worked with them much. It's just that you happen to be the camp physio, okay, and the team wins, and you think, hey, I was there, and it's so tempting for us to think, that I was there and they won and we're all team, yay, we celebrate. Fair enough, okay to celebrate, but you have to ask yourself that, did you really play a role? Was there anything that you did? And in a short period, if you travel for a camp, maybe, for 2 weeks, and then travel for comp, in 2 weeks, can you really do much? Okay, so these are very important self-reflective questions which help us improve. If we just get happy with winning, then there's a problem. We have to understand that when players win and when they lose, we have to get ourselves judged in both. If a player wins, doesn't mean that I have been able to contribute. I have to ask myself, what did I do? And this is a way of sort of, checking on yourself to know if I'm improving. Because if I just get happy with players winning and not really contributing anything specific to a movement where their smash is not stronger or where their jump is not higher, then that player could have won, especially in a sport where there's an opponent, they could have won simply because the opposite player or the team didn't play well. That can happen, right? It is not that somebody who wins is just winning because of the fact that they've improved. Their opponent could also have played worse. So we have to be able to judge exactly what our role was, which is in the physical capacity. And like I said in the beginning, you have to be knowing what you contribute, and then you can know if you've contributed right. So the contractual agreement, qualifications, experience, remember, these become sort of the important parts to know what to do, and there should be not to have friction between your work. Now, what does a strength and conditioning coach do? He trains a player to get better, okay, to improve. What does a physiotherapist do? He treats a player. So there's a difference between treatment and training, okay. So if you're a SNC coach, then train, don't treat. If you're a physiotherapist, treat, don't train, okay. Makes it easier, okay. Otherwise, if you cross these lines, people have, problems, and ultimately nobody benefits. The idea is, what do we want? You would want to be working in a team where the player benefits, he or she improves, and then the physiotherapist has a job to be done, the strength and conditioning coach has a job to be done, and everybody benefits. But if we're not clear what we're doing, then we're just sort of sometimes agreeing to what each other says. I could have a physiotherapist that I work with, and I'm good friends maybe, and we just agree. He says something, and or she says, and I say, we just agree that yes, this might be the problem. But are we really clear what we are contributing to that player? So a lot of good work happens when you are not having the most friendly relationships, okay, at work. It has to be an efficient relationship, which is good. It does not have to be a fancy relationship. So having relationships between a physiotherapist and a strength and conditioning coach which are professional and both are clear and there's respect will get a lot better results than just having these things where we just agree on, and ultimately if things don't work out, sometimes say, oh, the player maybe has a problem, the player is not disciplined, or the player is not so and so, okay. So we have to really understand this part of what is training and what is treatment, what is pain, okay. Between these two comes pain. So pain is the point where we know a physiotherapist comes in, a surgeon comes in, and so on and so forth. And this side is where the technical coach comes in and the SNC coach comes in, right? The next point, which is again about the same, just slightly a bit more detail, that player performance versus player injury. A strength and conditioning coach focuses on the player's performance, physical performance, okay, not a match performance where they win. That is technical, that is done by technical skills. The physical performance, is the player faster? Is the player hitting harder? Is there much more energy? So that's where the player performance comes in, okay. The patient injury comes in where the physiotherapist has, the expertise to know what to do. So you want a player in an ideal world. What do you want? You want somebody to be a player. You don't want them to be a patient. And interestingly, the strength and conditioning coach and the technical coach can actually make a player into a patient. How is that? Because they can overload, there's injuries, and then they can become a patient, and then they go to a physiotherapist, and then they get their rehab done, and if it's worse, go to a orthopedic surgeon. So it's important to understand this difference, okay, that the player can be made into a patient, and the physiotherapist who should and would want to make the patient into a player again. Okay, so if we know that there's pain, the division is pain, you don't want them to get too much into pain, you want them to practice, perform. That makes it easier. And coming to a point, which is very sort of sometimes this myth which exists that, no pain, no gain, is very old school sometimes, things which some of them which don't make sense. There are of course a lot of wisdom in old school methods as well, but that no pain, no gain. So then we are saying that no, if you have pain, somehow you'll improve. What is that pain? Is it DOMS? Is it, muscle soreness? Or is it an injury which is just going to get worse? So we have to be clear about, this part. And that's why understanding what is pain becomes so important for both sides, the physiotherapist and the strength and conditioning coach. And just making sure that the player is on this side of the line where there's no pain. They don't have unnecessary pains. They don't have injuries. The lesser the injuries, the better the physical performance. The greater the injuries, the lesser the power. Okay, so we have to understand this and make a difference so that both sides benefit. Okay, and there's less friction, there's less sort of, miscommunication. Now the last point, okay, and I've underlined that, right? This point, if you see, okay, here's somebody who's there, who's sort of like a person who's using like a book and maybe going to write a program or something. Now this part, okay, and I'm possibly going to make, yes, I've made this line so that everybody can focus on that, okay. What does it say? Make fitness part of your lifestyle. Very important, okay, not happens a lot. And often at conferences I say this, again maybe not liked by people sometimes, but we have to understand being fit yourself is extremely important for the strength and conditioning coach and the physiotherapist. If you yourself are not fit, the athlete will not listen to you, probably thinking that what does this person know about strength? What does this person know about power? What does this person know about soreness? True, isn't it? And again, sensitive topic, not everybody likes to hear this, right? But if I have myself not gone through training where I know what it feels to have sore quads, where I know what it feels, with certain movements, some days the glutes get sore, sometimes certain lifts, maybe the back is a bit tight. If I have not known anything at all, I could have read all the books, but if I have not done that, can I really teach somebody about it or speak about it? So one, the player or the sports person will not be having the best faith in somebody who hasn't themselves experienced. And the second is that your own program design, okay, or even rehab protocol, if somebody is a physiotherapist, or even the recovery protocol, you wouldn't be able to literally know what is the best for that player if you yourself have no clue. If you don't train yourself, you don't yourself put in at least an hour a day for your own training. So this part becomes important, okay, extremely important. And I'll repeat, make fitness part of your lifestyle. Now, does this mean that you have to look like some supermodel or like some, Bollywood hero where you are like really supremely fit and you're only focusing on your body? No, of course. But you have to have decent fitness. The earlier you start, the better it becomes for you, because then you're also following a lifestyle with the athlete knows that, okay, my coach also practices something which might not be at my level but does something. They put in some effort. If you are putting in zero effort, okay, you are just sort of, telling them this is weak, this is strong. How can you make that statement when you yourself don't know what is to be strong? I know these are very hard words. These are not what everybody likes. But at the same time, I'm also not saying that you get into fitness and become so fit that you're only obsessed with fitness, okay, and put in probably so much effort that you get injured. But you have to understand that unless you go through something, you will not know what it implies, even if you have the education, okay. You cannot make food and taste when you yourself have not tasted it, right? You wouldn't know the taste of that food. It's the same with programs. When you design a program, when you design a rehab protocol, if you are not training yourself, okay, and this I keep telling a lot of strength and conditioning coaches, a lot of physiotherapists, I say if you yourself are not following it and not showing it, how is the athlete going to? Would you believe, let's change. If you're a player and you have a strength and conditioning coach and a physiotherapist who tells you what to do, and they themselves have not done those movements, would you actually listen to them or really have faith? Important question, right? Think about this, okay? So like I said earlier, make fitness part of your lifestyle. It will help you a lot in not just your work, but in your own daily life as well. And nothing wrong in training a bit, nobody's saying put all your effort in fitness, but you have to be. If you're involved in sport, if you're involved in strength and conditioning, if you don't know what is strength and what is conditioning, what are you teaching? And if you're a physiotherapist who's talking about recovery, if you yourself haven't experienced it ever, then you're just reading something from a book and telling. How is that any different to any YouTube video, where somebody can speak? So we have to be able to have a little bit, like I said, I'm not saying you have to go extreme, but you have to be training yourself, okay? You have to be investing some part of your time in looking after your body, okay? And then the player will be having a better relationship with you simply because they know what you've gone through. And here I will give you a bit of a tip which I have used. You don't just do fitness and you don't just do agility. You do these. Make sure you have the basic fitness and you have the agility and the coordination and all those other 6 variables as well. Do these so you get to a point where you're able to lift weights in a gym, flexible, all the components, and then you're also able to do some coordination moves, and then try something like maybe boxing, okay, over a period of time. Maybe after a good 1.5 year of training, get into something like boxing. If you want to have even more skills, kickboxing, because now you're using your hips, kicking high, you know what is to have balance. And most importantly, when you have something like boxing or kickboxing, or maybe even a sport like badminton, you will know what it is to produce power with these exercises. So you've got your gym fitness and then you are able to take it to sports fitness. So when I practice myself and when I do certain drills, I always check when I'm doing my punches on the bag. Over the years, the decades that I've been doing practicing martial arts, I'm able to test it on myself and get a feel of what it does, and how it helps to improve my speed, to improve my punching power, okay? And then over the years, I'm also able to judge as age sort of comes in over the decades, how it changes. At my age now, I'm 50 years old, so at this age, I'm able to work differently. I'm not the same what I was at 20 or what I was at 30. But it's important that I try, so at least have some feel of it. Imagine if I have no clue. Over there, if I had never trained, from teenage, if I had no clue of training, am I really doing justice to the field? Am I really doing justice to the athlete? And am I really doing justice to myself, if I'm not training at all? So important point, remember, make fitness part of your lifestyle. Okay, hope this lecture helps clearing many of these doubts that we have, and hope this helps make everybody a better physiotherapist and a better strength and conditioning coach, and knowing exactly what you have to do while working with an athlete. Thank you.